Today I'd like to share with you a very interesting study published in JAMA Dermatology titled Low-Dose Metformin and Profibrotic Signature in Central Centrifugal Cicatricial Alopecia. Really like this study published in the September issue online of JAMA Dermatology. And so this study looks at low-dose metformin in patients with CCCA and shows us that it changes a number of genes and also helps reduce disease activity and help hair growth in a proportion of people. So as you know, CCCA is a scarring alopecia in Black women. It is a scarring alopecia that is very much underdiagnosed, and the most effective treatments are not clear. CCCA is treated with topical steroids, steroid injections, topical calcineurin inhibitors like tacrolimus, treated with oral medications like doxycycline. But the optimal treatment really is not clear yet. And there has been some suggestion dating back 4 or 5 years now that metformin may have a role in CCCA as well, and certainly is on the list in my clinic as a second-line option. And the authors here aim to assess the effects of low-dose metformin in patients with CCCA that didn't respond to standard treatments. And so this was a retrospective study where the authors looked at patients who had used metformin and looked at changes in gene expression in users of metformin. They studied 12 Black women with CCCA who had biopsy-confirmed CCCA, and they all received metformin at 500 milligrams of an extended-release formulation for at least 6 months. And then the authors looked at symptoms like itching, inflammation, signs of hair growth, and they took biopsy samples to look at RNA sequencing and changes in gene expression before and after the receipt of metformin. And so these findings overall were very interesting. Out of 12 participants, 9 who were receiving this extended release formulation of metformin noticed an improvement in their symptoms. 6 showed a little bit of hair growth, so 50%. Hair growth wasn't dramatic, so I think that's important to remember as we go through thinking about this study. But there was some slight improvement in 6 patients. But what was interesting is the changes in gene expression. There was an increase in keratin-associated proteins, which we know are key players in hair growth and skin development. Genes related to fibrosis were downregulated, like MMP7 and collagen 6A1. And these genetic studies also showed that there was a reduction in Th17 pathways and an uptick in pathways related to adenosine monophosphate kinase signaling after metformin treatment. And so this study of patients with somewhat resistant CCCA that didn't respond to standard treatments shows a change in gene expression, a downregulation in certain fibrosis-related pathways and inflammatory type pathways. And I think this is really interesting. And the use of metformin in CCCA has taken on significant interest in the last few years. And I think this is very much a needed study as we understand how exactly is metformin working in CCCA. And this study shows that it's affecting pathways very much relevant to scarring alopecia and hair growth. The study is small, 12 patients. Retrospective designs always have certain amounts of limitation, but nevertheless, a really important study. As we think about metformin and CCCA, I think it's important to not only reflect that, yeah, metformin does change these pathways. This is exciting. But to reflect also that metformin has a little bit of help. It's not dramatic. And so I think that we have a tremendous excitement in the world about metformin and CCCA, but I think we always have to go back to look at the data, and that is that it helps hair growth just a little bit. And in this particular study of 500 milligrams of extended release metformin, 6 of the 12 patients, 50%, had a little bit of hair growth, not a lot. But we need randomized studies in this area to better understand the role of metformin in CCCA, but I think this is a really, really important study in our field. What we don't know is, do higher doses make a difference? When I prescribe metformin in my patients with CCCA, I think about, should I use 500 milligrams once a day, twice a day? Should I go up to diabetes type dosing, 1,000 milligrams twice a day? How should I dose this? Should I use oral metformin, topical metformin? And so I think clearly we need additional studies in this very important area. And the other thing we want to understand is there's a group of patients out there that don't grow hair at all. 6 of the 12 patients had an improvement, but 6 out of the 12 patients did not. What are the gene expression changes in the people that fail to have an improvement? Do people that fail to have an improvement also have nice downregulation of fibrotic pathways and inflammatory pathways, but yet nothing happens to the hair follicle? I think we need clarification in that area. And when I look at these studies, and I'm closely following these metformin studies since 2020, when I look at these studies, my feeling is, if you were to give me, on one hand, doxycycline, steroid injections, topical steroids, and minoxidil, I still feel I can do a better job than what metformin can offer. And so metformin offers a different strategy, and clearly it offers a different strategy in patients that are refractory to doxycycline, steroid injections, topical steroids, but doesn't seem better. And so it's just another tool in the toolbox. And in my clinic, it's still a second-line option. It's definitely not a first-line option. Results seem much superior with doxycycline, steroid injections, and minoxidil. It does not seem in 2024 you could do better than those treatments in CCCA, but metformin is clearly different. The safety profile is wonderful. We're not dealing with antibiotics. We're not dealing with long-term steroids. So we need to push this area forward and understand these pathways more. I think this is a really important study, and I congratulate these authors. Next week, we're back talking about the use of metformin cream in CCCA. There's tremendous interest in understanding how topical metformin can be used in CCCA, and I'll introduce you to another very nice study in this area. Thank you so much for joining me for today's podcast. It's my belief that education and educational endeavors like this podcast can help clinicians acquire new knowledge, which can ultimately help patients. And education can also help hair loss researchers to ask better research questions. And better research questions can give clear answers about how to best diagnose or how to best treat hair loss. And ultimately, this will see benefit in our patients with hair loss. And education can also empower patients to acquire new knowledge so that they can engage in critical discussions with their hair loss practitioners, which hopefully will lead to improved care. At the Academy, we're really proud to be able to offer educational programs for clinicians, as well as educational programs for the public. And if you're a practitioner interested in studying hair loss at an advanced level, you might consider applying to the Evidence-Based Hair Fellowship, or EBHF. This is an intense program, but it's a program that equips you with the necessary skills to really help patients. Our next iteration starts January 2026, and we'd love to have you in the program. You can learn more about the EBHF by contacting our administrators at info@donovanhairacademy.com. That's it for this week. I look forward to seeing you next week for another episode of the Evidence-Based Hair Podcast. Thanks so much.